Hi, I'm Dr. Toby Moma, your host on Health and Wellness. It's a pleasure to have you on my show today. I want to introduce you to my guest, Dr. Jawan Crump, 30-year-old PhD in education from William Carey University, master's in speech language pathology from Louisiana Tech in Ruston, and a degree in science from the Women's University of Mississippi, Columbus. She's going to be my guest. She's going to be sharing her story of depression, of overcoming anxiety, and now fulfilling her dreams. She's married, she has a son, she's a pastor's wife, and she's living her fantasy, being a wife, a mother, a daughter, a sister, and also being a minister of the gospel. It's a phenomenal story, but most of all, she's going to share what she tells us about speech language pathology, why that is such an important field amongst our children. She works in the Jackson Public School District, and she's going to be educating us on what to do to help our kids. You don't want to miss it. Look forward to seeing you. Jesus is Lord. God bless you. Hi, this is Dr. Toby, your host on Health and Wellness. Thank you for joining us. And I just want to push this out there. I know COVID-19 has done a whole lot of damage, but I believe in the God of restoration. Acts 3:21, the Bible says that Jesus will come back after there has been a restoration of all things. It's not what God has intended. COVID is not the plan of God. It's a end-time pestilence from the pits of hell. And our focus is to let you know that if you are on the Lord's side, I believe there will be a restoration. Whatever you've lost can be restored. The home, the job, the family, God can restore the peace, the love. Don't quit now. Don't give up. Don't throw in the towel. There's hope. There's a blessing at the turn of the month. I believe July is going to be a beginning of new months. I believe you're going to see a breakthrough that will astound your biggest expectations. So don't quit believing God for a breakthrough. Don't say, well, this is the end of the road for me. No, I believe there's a bigger blessing coming in 2020. In 2020, it's the year of liberty, and I believe God is going to move you from one level of freedom to another level of freedom. And we've been enjoying talking with Dr. Jawan Crump. She's the oldest daughter of her parents. She's a speech language pathologist. She has a doctorate in education from William Carey, and she's a mother of a son and a wife of a pastor who's also a teacher. And she's a woman of diverse parts. She's a sister, and I didn't know she sang in the choir, but now I know that. So she's a woman of multiple talents, and she's sharing her heart with us on speech language pathology. Our paths crossed 9 years ago when she was here in Ruston, and we were part of the Assembly West Monroe, and we were able to work together on some projects, and she's been an awesome person, and we reconnected when we got back to Jackson, and it's been a blessing knowing her. And I said, can't you come here and share with my viewers about speech language pathology? And she was really glad to come, and she's been a blessing. And she's going to help me here because I have a problem with people with the southern drawl. Tell me about that. Is that a speech defect, or is it just a natural blend to their language? I mean, do you guys work on that too? Or because people talk to me and say, where are you from? I said, I'm from Mississippi. They said, no, you're not. Your language, you don't have the southern drawl. So, do you guys work on people with accents, with definite, distinct language concentrations that make it difficult to speak with the normal English phonation? What do you guys do with those kind of folks?
So, believe it or not, we do work on accent modification, and that is to decrease the strong accent um, identification that comes with some people. That is not something that I am strong in because I personally believe I have a very strong Southern accent. Um, but yes, we
Like
do work on it.
y'all and
Yes.
what's the other? I
No.
just came here from New York, and I'm hearing all this, y'all and stuff that I had never heard in New York City. When I worked in Ruston, I was like, my nurse would shake her head, and I was like, is she under some demonic oppression? Because I didn't know. I had never seen a woman shake her head and do that. I was like, what's wrong with you? And then she will point her finger, and I was like, is everything okay? So nobody had educated me on the South, and the patients would come and, be speaking in a way that I had a hard time understanding. But do you consider those pathologies, or are they just normal, natural phonations?
Well, some individuals we consider it dialect. For individuals such as those that come from New Orleans, even individuals that might be from Mississippi, those that come from Alabama, and that may be very stereotypical, but we all know that we can typically tell where a person is from based off of where they sound. We call that dialect. And with that, we don't call it a disability or something that is wrong. It's just something that's different.
How about Ebonics? Am I correct? Have you heard of Ebonics?
Ebonics?
Ebonics, yeah. So I'm an African, and I came here I was how old? I was probably 30. I think I was about 30 when I got to the United States. 30 to 31. So I had no idea of Ebonics.
Okay.
So I was shocked when I heard the parlance of the African American, and it was very different from the Caucasian.
Very.
So I don't know if you can demonstrate a few. I'm blanking out on anyone I can think of right now. But is that a speech language pathology concern if I send my child to elementary school and he comes back speaking Ebonics? Do I send him to you and say, see the language therapist, you're speaking the wrong stuff? Or is that a normal experience in a child in elementary school in the South?
Well, interestingly, it's called code switching. Individuals that can code switch is very good socially because they can socially adapt in different environments. So it won't be a cause for concern unless it's something that you socially don't accept. But no, it won't be a cause for them to go to the speech therapist. But it can be beneficial for them.
So give me an example. So my viewers may not know what an Ebonic is, especially those who are international viewers.
Okay,
so give us a few examples if you know any.
Oh, I definitely know some. So when I am...
And why did they call it Ebonics, by the way?
Now, I don't know why they call it Ebonics, but so, for example, I went to a 99% African-American high school.
Callaway or?
No, I went to Jim Hill.
Jim Hill, okay.
Yes.
I'm sorry.
And so I was talking to my husband last night, and I said something, and he said, now listen, don't start sounding like those people from Jim Hill. And I was saying, look, I think you got me bent. And I totally bent.
Bent, okay.
And meaning you twisted or got it wrong,
right.
or yes. So bent is one. Capping. Yes. I'm trying to think of some more. It's so easy to just say them versus just thinking of them.
But is it a Southern thing or is it an
No,
African American thing?
I think it comes more from the music
of
African Americans.
Okay.
Yes.
So I'm sure the Hispanics may have some lingos that they
definitely
have in their vocabulary.
Definitely.
And maybe even Africans. I mean, if you come to Africa, we have Pidgin English, which is English with a very local descent. I mean, it's broken English.
Okay.
It's kind of like the Creole in Haiti.
Okay.
So it's not clean. I don't know what the word they use. It's Creole they speak in Haiti, right? But there's a local kind of Creole
Okay.
that is less French speaking like.
Okay.
It's broken. So that's what you find in Africa a lot.
Okay.
If you go to West Africa, where I'm from, they have the broken English.
Okay.
And
So
so
it's English. It's just
it's English, but it's
mixed.
with a lot of brokenness in
Okay.
it. Yeah. So, like, somebody will tell you, "Now you waka come." That means, are you the only one who came? Which is somebody who hears that will not even have an understanding what that statement means.
Wow.
So this was the president's wife in my country, and they kidnapped some girls, and this was on TV.
I
national
saw
news.
that.
And she asked the principal of the school, "Now only you waka come." Now that is what we call broken English. But this was the president's wife. I mean, she has a degree, she's educated, just to show you how much the broken English had become normal fluency. But what she
Wow.
meant when she said, "Now only you waka come," it meant, are you the only one who came? You know? And she went on and on that day, and it's become such a hilarious soap opera for us in the country, because this was the former president's wife, by the way. And she went on and on. That same day, she started crying, "There is God, oh, there is God, oh." All this blood that they are shedding. This was what she was saying on TV, but I'm just trying to make a joke, because people may look at her and say she's butchering the English language, but in her environment, that was the way they communicated
Yes.
in that language. So Ebonics are kind of like broken English
Yes.
in Africa. So it's an interesting experiment. Thanks for enlightening us on that. So give us a few ideas of your mentors. I mean, I try to get that idea from you. What made you? You told me you had a fluency defect. You told me you wanted to be a blessing. Did you have role models in that area of speech therapy? Did you have people? And I'm going to go into it a little bit later, but you told me your dad worked for UPS.
Yes.
And your mom is a library
Bookkeeper.
bookkeeper. So how did the speech, obviously you had that inspiration from when you were a little child, but was there any mentors, real life speech language therapists or pathologists that gave you some inclination to go in that field? Apart from the woman who treated you when you were a child. Yeah.
No speech pathologists in my general area that were mentors. As a matter of fact, lately, and this is only lately, have I been pulling out to find mentor speech language pathologists to help me broaden my horizons and move forward, because it is a very big field, but because it is so big, it can also be very narrow, because you can specialize in so many different areas.
But obviously you have fellow co-speech language pathologists at your school.
Yes.
At Jackson Public
Yes.
School. Okay. But are you under someone's supervision, or do you practice independently? How do you guys, because for example, I'm a assistant professor, but I have a chairperson. I have residents who I supervise. So it's kind of, medicine is kind of hierarchical. There's always that hierarchy in the medical field. How is it in speech language pathology? Do you work under someone's supervision, or do you just do your own thing?
This year we didn't have that. It was, you do your own thing, pretty much.
So where you're going, is that going to be different? Because you sounded like you're going somewhere different.
I don't have a clue where
Oh,
I'm
really?
going.
Okay.
So maybe I'll
Okay.
have a listener that
Okay.
I'll go somewhere where they're looking for someone.
Okay. Tell us a bit. So I was thinking about, what role do you think? I've heard a lot of people talk about dyslexia. Is that part of your area of operation?
It is not.
Okay.
Although we do work with students that that might have literacy issues, working with phonological awareness, but dyslexia has become its own specialty.
So it's more under the psychotherapist?
No, it's more under a
Okay.
reading specialist.
Really? Okay. I guess the K Center has all that then. Because I've never thought about who to refer my. So, like, I get patients who come in and their parents say, he's not reading up to his age level. And what I do is I send them to the K Center,
Mississippi College actually has their own center.
like a reading specialist
Hmm.
center. Okay, interesting. Mm.
And also, we work closely with the Auditory Processing Center and Clinton, because we oftentimes have children who it appears to be a language disorder, then it ends up coming back that it's a central audit, a central auditory processing
Mm.
disorder, that there's some sort of auditory issue that.
Tell us a bit about what you guys do in people with trauma, strokes. For example, a soldier who had a bomb blast and lost his hearing or his speech, or somebody who had a stroke in his Broca's area and can't talk effectively. What do you guys do in those areas?
Okay, so depending on what the diagnosis is, we work to rehabilitate them back to a functional level. So, for the first person that you mentioned, let's say that they may have lost hearing, we would work with the audiologist, doing some sort of oral rehab, to get that patient back to a functional ability to be able to communicate with others. And then for the other patient that may have some sort of injury in the Broca's area, we may work with some sort of planning, because that patient may have um, a lot of language issues. And it could come with there could be a lot of aphasic issues there.
Mm.
And so, depending on what issues are apparent, we would set up some sort of treatment plan to work best with them to be
Mm.
functional.
What are your implements? When I go to a physical therapist, they have a gym-like instruments, they have treadmills, they have weights. When I go to occupational therapy, they have all this balls and stuff. What does a speech language therapist, pathologist, what's in her arsenal? What is in her kitty, in her armamentarium?
Okay, so for me, I like to use a lot of functional activities. So if I'm working on memory, I like to use materials that individual will need to remember. I don't like to pull words that are novel that they don't typically hear. If like words that an astronaut might use if the person was a plumber. So we tend to work with very functional materials, um, and then working with different working with different instruments that have just been
Mm.
proven to work, because we have such a large scope. We could just be
Mm.
using a number of different things.
Wow. Tell me a bit about what will the public, a speech language pathologist do in a COVID-19 emergency setting?
Wow.
What kind of role would you play? I've heard of things like people are getting emotionally distressed. Some have this shut in. They lose their. I've heard of people who can't vocalize because of the trauma they've
Hmm.
experienced. So, what would you do if you had that kind of patient who faced a certain level of trauma and it has hindered them from vocalizing? What role would you try to do in that case?
So, in the event that there was a patient that had been referred, and we're thinking that they have been traumatized and that's why they are not speaking, we might want to refer them to a mental health professional first, and then see what they have, and then if there is something that they cannot do, then then we may need to work with them in some way.
Mm.
But in terms of COVID-19, we are working on the front lines primarily, um, with with teletherapy. Um, our patients are still having to receive therapy because we cannot abandon them.
Right.
Um, and then for those that are in hospitals and in long-term healthcare facilities, we're having to beef up our PPE or personal protection equipment, and we're still having to go in and provide care.
And as a physician, I know that there are several times we intubate a patient
Hmm.
and we at times damage the recurrent laryngeal nerve.
Yes.
And when the patient is extubated, they are difficult. They have dysphonia, they're hoarse, they can't regain their voice.
Hmm.
Is that part of what you guys do?
Yes.
Okay. So do you do voice training or do you just do exercises or do you do I know my colleagues do Botox injection in some
Hmm.
cases.
So after the physicians do the Botox injections, these speech therapists come back and do all of the behavioral exercises with them to build those
Mm,
vocal cords back up.
okay. If I took you to Africa on a missions trip to help me, use medicine to preach the gospel, typically we go every year, we go in September, we feed the people. We get thousands of people. We feed them every day, morning and night. We give them free clothes. We bring some clothes. We give them free medicine. And we preach the gospel to them. And I wanted to know what role would a speech language pathologist play in a rural African outreach crusade? Our facilities are bare bones. We have maybe medications, we have doctors, but we don't have like state of the art equipment. So what area would you think a speech language pathologist would be useful in Africa? And if your church in America wanted to do something in the community, what role do you think you can play as a speech language pathologist to augment the gospel through your profession?
Um, Education is always important. Starting with educating the people on what's typical, what's not typical, what to look for in typical swallowing, typical feeding, in typical development of children, for children with developmental disabilities, children that might be born with cleft lip and palate, um, and then just working with them and then working with medical professionals that are there on um, on developing some sort of strategy or techniques to work with families, or even developing some sort of little council or some sort of little network where we can still work together even once we are no longer physically there. We can still
Mm,
work together to ensure that these people are still able to get questions answered, or even as these children are still being born, issues are still coming up. We're still
right.
able to help them.
How about in the U.S.? If you were to work in your local church as a speech language pathologist and you want to support the gospel with your profession, how would you support the gospel in your local assembly?
Um, Still, and is this still helping with back overseas or
This is
just here?
here. Yeah.
Okay.
Hmm.
Um, I think currently we are always doing something,
Oh,
and that's through clinical health fairs, hearing screenings. We know that charity starts at home and then spreads.
so educational.
Yes,
Okay.
definitely. And I mean, whenever there is any need, we are meeting it. And if they come with questions, with something, we're there. And if it's something that we have, we are bringing it to them.
Mm. A lot of my viewers are curious. What
Hmm.
are your prerequisites to enter speech language pathology? You said something about you didn't like math. Can I stop taking math before I graduate from high school to be a language pathologist? What are the majors you took in Columbus that helped you enter speech language pathology? And what were the majors in high school that you think helped you to be a speech language pathologist today?
Okay, so as long as you graduate with a traditional high school diploma, you should be good to enter into a traditional 2 year college and then into a 4 year university, or straight into a 4 year university. While you are at that 4 year university, you will have to take college algebra. And depending on what college and those college requirements, because every college is kind of different, you will have to take certain maths and certain sciences. For certain, you will have to take chemistry, I believe. That is one of the new requirements, or physics. You will have to take some courses that might be a challenge, but again, like I said, challenges only make you stronger. They teach you something new. So go on the ASHA website, look up what you might need, check out those schools, see what are some of those courses that might interest you, some that you might be able to sub out for some things that you've always wanted to know, and see what you can learn more about.
How about the courses while you're in speech language pathology? It's a 2 year program, right?
Yes.
So what courses do you run in those 2 years in speech language pathology?
Is this undergrad or grad?
Grad.
Okay, grad, you will take okay, so every university may call them something different, but you will take various courses that will cover topics such as neurodevelopment or neurogenics, assessment in children, assessment in adults, treatment in children. Um, I think I said
Anatomy,
diagnostic.
too?
Yes,
Anatomy.
anatomy and physiology.
Physiology, yeah.
Ethics is one. Articulation, feeding, swallowing.
Okay, wow. So Dr. Crump has been pouring out her heart. I hope she's motivating someone listening to be a speech language pathologist. If I wasn't a physician already, I might jump into that. It's really exciting and sounds intriguing to make people who had a problem speaking to speak better. And next show, she's going to share about her personal life. She's had some battles like everyone else. She's had her scars, and she's wearing them like her stars because God has given her the victory. She's going to share her personal life, her family life, and how God has kept her in the last 30 years and what God plans to do in the next couple of years in her life. So you don't want to miss her testimony. It's a testimony that I believe will inspire, challenge, and motivate you. This is Dr. Toby Moma and Dr. Crump saying Jesus is Lord. Don't miss this show next week. It's going to be awesome. God bless you in Jesus' name. Awesome.